time to talk health and wellness with our friend Dr. Guevara from Texas Family Wellness Clinic. And today we're going to be talking about cholesterol. Admittedly, I'm familiar with the word, and to this day, I still am not really clear on what cholesterol is or what high cholesterol is. So what is it, and why does everybody have it now?
Right. So cholesterol is considered a risk factor for vascular disease.
Okay.
So it puts you at risk for having things like strokes, heart attacks, peripheral artery disease that may require things like amputations of part of your foot or leg. So it is important to make sure that you know what your cholesterol values are and how to correct them. Cholesterol is made by your liver, but it also does come from your diet in the form of things like red meat and eggs. I believe that people have high cholesterol for one of four basic reasons. One of them is poor diet. Second is something you can't control, right? Your genetics. Third would be maybe a combination of both of those things, so maybe a little bit of a poor diet, poor genetics. But the fourth thing, in my opinion, is that your body makes cholesterol to help control inflammation. So if you have some kind of inflammatory issue, let's say high blood pressure, causing inflammation of the lining of your arteries, cholesterol's job in part is to help smooth out that inflammation.
Okay.
Unfortunately, we sometimes don't correct those things that cause inflammation, so we continue to have problems like high blood pressure or high blood sugar or high insulin levels, or we smoke, or something that causes that inflammation to begin with. And cholesterol goes in and tries to smooth out that inflammation, not knowing that it could be causing a narrowing of that artery over time that could lead to one of those problems that we talked about earlier.
So when it comes to that, we talk a lot about vitamins, supplements. Is that something that can assist us in remedying our high cholesterol?
Absolutely. So the treatment of cholesterol, I think, number one, begins with an appropriate diet and nutrition plan. So seeing our registered dietitian over at Texas Family Wellness Clinic can be very beneficial. Of course, regular exercise, like you mentioned. So a combination of cardiovascular and resistance training is going to be really important. So we can advise you on that. But definitely supplements. So a lot of the supplements that are on the market are actually things that prescription medications have been, formulated from. So an example would be the statins that we now prescribe for high cholesterol were actually derived from a product called red yeast rice. So this is a natural supplement that can help to lower cholesterol. Fiber comes in the form of pills now, so you don't have to eat a whole lot of vegetables to get that fiber to help reduce cholesterol. B vitamins like niacin now comes in a prescription strength form. So all of these different supplements can be used to help lower cholesterol. And if that doesn't work, then there's always prescription medications that we can use. Of course, we want to try and minimize that as much as possible, only to prevent things like side effects and things like that. So.
And when it comes to those things, we've talked about it here in the past on the show, but you want to make sure you're taking the right vitamins and supplements. There may be brands and ingredients that are better for your body to absorb them well, so you can go check out some of our older visits with Dr. G for more information on that, or just give them a call, make your appointment, apply to be a patient. They have a new location opening on the south side very, very soon, and we're so grateful for all this useful information, but even more so for your approach to medicine and the way you're taking such great care of us. So go visit Dr. G and his team over at Texas Family Wellness Clinic, and don't forget to mention Coastal Living sent you. Thank you so much.
Thank you.
Health and Wellness with Dr. Guevara is paid for by Texas Family Wellness Clinic.